Welcome back to our channel. I'm Dr. Elena.
And I'm Dr. Natasha.
So how do you know if you have diabetes? It's a question that I get a lot of times, and to be honest, people don't come into my office saying, hey, I think I have diabetes.
Not at all.
So some of the symptoms you might notice are increased thirst, increased urination, increased hunger. And that's often because your blood sugar is so high that you feel thirsty. You're trying to water yourself down, essentially, to stabilize your blood sugar. And then also you urinate out all that extra sugar. Your body's trying to neutralize all that blood sugar, so you might be running to the restroom more often than you normally would.
Oh, yeah.
And one thing that people don't often realize is that you can have weight loss when you have really high blood sugar over time. So you might say, hey, all of a sudden I've been losing 10, 15
I'm doing
pounds.
great.
I'm doing great. I'm not even changing anything. But that's just because your body's just burning off all that extra sugar and
we hear it all the time, don't we?
Yes.
And we feel kind of bad going, well,
yes.
It might just be because your sugar's high.
Yes, but like I said earlier, most people have have no symptoms whatsoever when they come in. It's usually just a routine blood check that we say, hey, let's get some baseline labs, and then we realize the blood sugar is high and we want to go look into some things. So say you have some of these symptoms, the increased thirst, increased urination, unintentional weight loss, increased hunger, and you go visit your doctor. Your doctor might run some tests to determine, hey, what's going on? Try to figure out why you're having these symptoms. One test they might run is a UA, or a urine analysis. And that way it checks your urine not only for bacteria to see if you've got a urinary tract infection, but we might also find some increased sugar in your urine. That means your kidneys are essentially spilling and trying to get rid of the excess blood sugar.
Otherwise known as glucose. You might see that on your labs.
Yes,
so
yes,
glucose,
that's a good
sugar, same thing.
Yes. Also, oftentimes we're going to run some blood work. I know it seems like whenever you visit the doctor, we want some blood from you, but that's because we can find out so much useful information. So, like we can see your glucose in your urine, we can also see your glucose in your blood, like Natasha talked about a little bit earlier. We can see if those glucose levels, no matter if you've eaten or not, are elevated. And then oftentimes if we notice those glucose levels are elevated, we'll check a hemoglobin A1C. And like Natasha says, it gives us about a 3-month average of what your blood sugar has been running. So when we're diagnosing diabetes, an A1C of 6.5 or above is indicative of diabetes. But there are some risk factors that we do notice people have with diabetes. One of the risk factors is prediabetes. And so Natasha talked a lot about what your blood sugar and A1C should be in the diabetic range, or what control looks like when you're in the diabetic range. But we do notice that sometimes people's blood sugar are slowly creeping or quickly creeping outside of that normal range, and we're cued into focusing and making sure that blood sugar doesn't continue to elevate. There are certain factors that increase our risks of developing diabetes over time, one of which is prediabetes. What that means is your blood sugar is a little bit high, but not yet in diabetic range. A1C can be helpful in diagnosing this as well, whereas a goal of less than 7 is useful for someone who already has diabetes. We might look at a hemoglobin A1C between 5.7 and 6.4 as a pre-diabetic, and so not yet diabetic, but maybe heading in that direction if we don't make some lifestyle changes or even medication changes to bring down the blood sugar. Also, I know we've talked about this before, you've heard it before, being overweight or obese does increase your risk of high blood sugar and developing diabetes and prediabetes. So trying to keep your weight down, trying to watch diet, things like that, exercise is helpful in bringing blood sugar down and decreasing your risk of developing diabetes. Also, family history. A lot of us, especially in minority groups, African American, Native American, Hispanic, we are at an increased risk of developing diabetes.
Absolutely.
So oftentimes we hear of our parents, our grandparents, our brothers and sisters have diabetes. So that's one thing that you've got to kind of key in. If you have a big family history of diabetes, it's important to get checked and try to reduce some of those other modifiable risk factors as well. And then age. As we get older, it seems like everything kind of breaks down.
Yes, unfortunately.
And diabetes is one of those things that follow as well. So if your age is over 45, it's really important to get checked, know what your numbers are as far as blood sugar, and make sure you're not pre-diabetic or diabetic.
Absolutely.
And I think a lot of us are guilty of this right now, especially in these times. Physical inactivity if we tend to spend more time on the couch or sitting behind a desk like I do all day,
Same.
we are at risk of developing diabetes. So trying to make time to move your bodies, remain active, is very helpful in reducing those risk factors. Another risk factor is if you've had a baby over 9 pounds or if you had gestational diabetes when you were pregnant, you do have an increased risk of developing diabetes later in life. So it's important to keep an eye on those things as you go on.
All right, so let's get into complications. So I did talk about some earlier, but I want to get into a little bit more detail. So one of the complications is retinopathy. So that sounds like a fancy word. What is that? So retinopathy is essentially damage to the blood vessels in your eyes. So that is pretty important. I think we can agree that our eyesight is very precious, and we don't want that to wane over time, worsen over time, or we don't want you to go blind. And that absolutely happens. We have seen it happen to patients,
unfortunately.
and we want to avoid that for you at all costs. And then make sure also that you're getting your yearly eye exams. That's very important. Screening for all of these is important, so please take it seriously.
Yes.
One of the next complications is nephropathy. So nephropathy means your kidneys. That's damage to the kidneys, especially as a diabetic. Naturally, the disease is going to progress over time, and your kidney function most likely will worsen. Now, you can determine how fast that goes, but your kidneys do worsen over time. Now, we will get some confirmatory lab values to see what your kidneys are doing. So that will be in the blood in the form of something you may hear, serum creatinine, EGFR, or even they'll take a urine test and kind of see how much protein is getting in your urine, because you're not supposed to have protein in your urine. It's not supposed to be able to be filtered out. So if it is, what that means is the holes in your kidneys are a little bit too big, and those proteins are spilling out into your urine. So make sure you go to your doctor for your regular routine labs, and they will monitor that accordingly. But of course, as we said before, diabetes control will help this greatly, help keep your kidney function intact.
Yes, it's just important to have your routine blood work, like you mentioned already, because a lot of this stuff we can check and test and detect early before it progresses too far. And that way, if we notice that, hey, your kidney function has decreased, is there a medication that we can change? Is there something that we can put you on to slow that progression? Or we just need tighter control of your diabetes and high blood pressure. So
yes, that's a great point. And next would be neuropathy. So that's essentially damage to your nerve endings. So like I said before, the sugar can kind of ruin your nerve endings, and that's when you go see Dr. Elena and you say, I have tingling in my fingers, tingling in my toes, and that's something that we really don't want you to have, because it's uncomfortable. Doesn't feel good. It makes you kind of restless, and you just really don't want to get into that territory if you can help it at all costs.
And not only is it uncomfortable, sometimes it's just numbing. You can't feel if there's a cut or an ulcer or an injury to your foot like you would if you had, the sensation that wasn't damaged because of the high blood sugar. If you have a cut on your foot, most of us would be able to look down and make sure it's clean and taken care of. But if you have diabetes and can't feel it, sometimes that cut can get infected. And that's when it can develop into an ulcer or a worsening wound. And when you hear about people who have to have amputations of their feet or limbs, it's often because something was undetected too long, and then we had to cut the limb off just to save the rest of the life. So you might notice when you go to the doctor, or maybe a diabetic, when they go to the doctor, they do a foot exam. So we check the integrity of your skin, we check your sensation, we make sure there's no ulcers, wounds, and we also will check to see if you can feel vibrations. And that's all just checking for neuropathy and any complications because of the diabetes.
So that brings me to another point of daily foot checks. You should always be looking at your foot every day if you're a diabetic, just to make sure nothing's there, everything's clean, no cuts. Wearing good shoes that have nice form around the house. Don't walk around barefoot. And then also getting your yearly foot exams, whether it be your primary care provider or if you see a podiatrist. And the next one would be cardiovascular disease. So what does that mean? That could mean a heart attack or a stroke. And as a diabetic, you have an increased risk already of having cardiovascular disease. So I always tell people, when I say these things, they assume that they will come back from the heart attack, come back from the stroke. But these things also can be fatal. So we want to impart to you the seriousness of all of this. and again, keeping your blood sugar controlled. Another thing I tell patients is this is a snowball effect. I've seen it time and time again. Dr. Elena has seen it time and time again. You could feel fine. I'm doing good. I don't understand what this whole big thing about diabetes is, but we've seen it. Okay, you come in with one thing. Oh, I can't feel, my feet. I'm getting tingly sensations. And then the next thing happens and the next thing happens. And it's a snowball effect. So you really want to kind of halt that train as much as you can. Yes. And you have that power with what you're eating, how much you weigh. If you don't know, I know there's several resources your doctor can provide, or other people your doctor can provide, your clinical pharmacist can provide. So just ask, but we definitely want you to not start getting in that rhythm of having this happen and this happen and this happen.
Exactly. So you were diagnosed with diabetes. Now what happens? How do we progress? And is there a cure for this? A lot of people have this question or have this concern after they receive that diagnosis. Right. So unfortunately, diabetes is a continuum. It often does progress over time, but that's not to mean that we cannot slow that progression, as you were talking about. It cannot be cured, but it can definitely be controlled and it can be slowed. And Natasha will talk a lot more about medications that we can use.
So now let's get into my area of expertise, and that's medications. So when you first become a diabetic, a lot of people, the first thing they think about is going on insulin. I don't want to go on insulin. I saw my grandmother give herself all of these injections. I don't want to have a diabetic coma, people say. So there's many ways that diabetes can be treated. Now that's up to your provider and many, many factors. So it is possible you may go on insulin initially, depending on how your blood sugars are, but you don't have to be on insulin initially. And again, that's up to the provider and a lot of different factors. So we're not saying if you do go on insulin initially, it's wrong, but that does not have to be the first step. So how do we choose some of those medications? So there's a lot of different things we'll look at. Some medications help prevent the progression of kidney disease, so we want you to be on those. Some medications, especially if you already had a heart attack or a stroke or something like that, they help prevent having another heart attack or stroke, or generally are just good for your overall heart health. So we like those medications, those classes of medications as well. So there's a lot of different things we look at. Some medications have a higher risk of low sugar. Some don't have as much of a risk of low sugar. But overall, I like to tell people, because I get asked all the time, why can't I get off of some of this? Why can't I only take, there is not necessarily one wonderful medication that will control your diabetes. Maybe in the beginning. It's very, very possible. There's lots of diabetics only on one medication and they're fine. Over time, after you've had it for so many years, especially if you're not doing your part from your diet and your exercise point of view, then it's almost like we have no choice but to add other medications on. But essentially, the reason why we add medications is because we need more help. So if the one medication is not working, it doesn't mean it's just not working. It might not be enough to control your diabetes at this time. So we need to add a little bit help to it in the form of another medication or another injection. And that tends to confuse people, why we're not swapping out. That can happen. We 100% can swap out medications. But generally speaking, we need more help. And we're trying to really get tackle the diabetes from different areas, and they all work a little bit differently. And like we said in the beginning, diabetes is very complex. And there are a lot of different broken systems in the body that we're trying to help fix. One other point that I really want to mention, because I hear this very often from my patients, if you're on diabetes medication, the medications are there to decrease your sugar. So remember, we've been talking about uncontrolled diabetes being high sugar. Well, we're trying to decrease the sugar. So it is not likely at all, really, that you would be on a diabetes medication and it would be have a purpose of increasing your sugar. Now, where this gets confused is because we're constantly having a tug of war talk with you. We don't want your sugar too low. We don't want your sugar too high. And that's true. Both are can be very dangerous for you. Too low of a sugar, too high of a sugar. So that's why we don't want you to be over medicated with the diabetes medication. But we also want you to have enough on board so that you're staying in a nice balance. Right. So let's just say your diabetes is controlled. You're at a pretty good place. Your doctor is like, good job, you're doing great. Then you're probably wondering, all right, well, let's get off of this. But that is probably the reason that you're kind of staying in a wonderful, nice, even place of being at goal. So we cannot say you're doing good, let's take this all off, because I promise you will go backwards. There are times that I've taken off medication of patients, you taken off medications, because you actually are doing really well, and we need to peel away some stuff to avoid low blood sugar. So that wraps up our overview of diabetes. We have so much more to say about diabetes, so look for some upcoming videos on specific topics with more details. But head over to our website. We put the link below, and you can download some blood sugar log sheets and jot down some of your blood sugars that you've taken from your meter. Now, why is that important, you ask? I check my sugar. You can look at my meter. What's the point? There's a couple reasons. When you come see us, it's very nice, easy to see, okay, you took this before your meal, at bedtime, the time of the day, like we talked about. The goals matter depending on when you take your sugar. Also, it's good for you. It actually helps you say, oh my gosh, I got a 300. What did I eat?
Right.
And then you could write a little note like, I had 5 pieces of pizza. That's why it happened. But it really helps you kind of know what your food does and how it affects your blood sugar. Or I had a low sugar. I wonder why. Oh, I skipped a meal. That's really helpful for you to know, and helps you control your diabetes more, along with helping us as well.
Thank you for joining us today. I hope you found this information useful. Be sure to subscribe to Prescribed.
And also head over to our Instagram, leave some comments there and here, and let us know what type of topics that you like to hear. All right, we'll see you next time. Bye.